Intestinal failure, IF, occurs when the intestines cannot digest food or absorb nutrients and fluids adequately to sustain health. It is typically classified into three main types based on the underlying cause and duration. 1. Acute intestinal failure. Definition: a temporary and often reversible condition requiring short-term nutritional support. Causes: postoperative ileus, infections, Clostridioides difficile colitis, acute mesenteric ischemia, severe inflammatory bowel disease flare-ups, acute pancreatitis with associated gut dysfunction. 2. Chronic intestinal failure. Definition: a long-term or irreversible inability to maintain nutritional autonomy without parenteral intravenous support. Causes: structural causes, short bowel syndrome, e.g., due to extensive surgical resection, congenital abnormalities, e.g., intestinal atresia, functional causes, motility disorders, e.g., chronic intestinal pseudo-obstruction, neurological diseases affecting the gut, radiation enteritis, severe malabsorptive conditions, e.g., celiac disease in advanced stages. 3. Acute on chronic intestinal failure. Definition: a transient exacerbation of chronic intestinal failure requiring additional or intensive interventions, such as hospitalization or modifications in nutritional support. Causes: superimposed infections, bowel obstructions, dehydration or electrolyte imbalances, complications of underlying chronic disease or parenteral nutrition. Classification by mechanism. An alternative classification approach divides intestinal failure into Type 1, self-limiting and short-term, e.g., post-surgical ileus. Type 2, prolonged but potentially reversible, often requiring specialized care, e.g., following trauma or severe infections. Type 3, long-term, irreversible, requiring home parenteral nutrition, e.g., in short bowel syndrome or chronic pseudo-obstruction. Management strategies vary depending on the type and severity, ranging from dietary modifications and enteral nutrition to parenteral nutrition and intestinal transplantation in severe cases. Intestinal failure, IF, occurs when the intestine cannot digest and absorb nutrients, fluids, and electrolytes adequately to sustain life or growth. Treatment of intestinal failure depends on its severity and underlying cause, but generally includes the following approaches. 1. Nutritional support. Parenteral nutrition, PN, intravenous administration of nutrients is the mainstay for severe cases, particularly short bowel syndrome, SBS, or severe malabsorption. Enteral nutrition, gradual reintroduction of nutrients through the gastrointestinal tract when feasible to stimulate intestinal adaptation and prevent atrophy. Oral diet modifications, specialized diets low in fiber, fat, or tailored for specific malabsorption issues, e.g., low oxalate in short bowel syndrome. 2. Pharmacological therapy, antidiarrheal agents to slow intestinal transit and reduce stool output, e.g., loperamide, diphenoxylate. Proton pump inhibitors, PPIs, to reduce gastric acid secretion and decrease fluid loss. Motility modifiers, if dysmotility is contributing to symptoms. Growth factors, such as tetraglutide, a GLP-2 analog, to enhance intestinal adaptation and reduce dependence on PN. 3. Electrolyte and fluid management, oral rehydration solutions, to manage dehydration. Electrolyte replacement therapy, intravenous or oral supplementation of sodium, potassium, magnesium, and calcium as needed. 4. Management of complications, liver disease, preventing and managing PN-associated liver disease with lipid modification or fish oil-based emulsions. Infections, addressing catheter-related bloodstream infections, CRBSIs in patients on PN. Nutrient deficiencies, supplementing vitamins and minerals, e.g., fat-soluble vitamins, B12, iron, and zinc. 5. Surgical interventions, bowel lengthening procedures. Techniques like the serial transverse enteroplasty, STEP, or Bianchi procedure for patients with short bowel syndrome. Stoma reversal or revision, for specific cases where bowel continuity can be restored. Intestinal transplantation, for irreversible intestinal failure with complications from PN. 6. Lifestyle and supportive care. Dietitian support, individualized meal planning to optimize residual gut function. Psychological support, to address the emotional and social challenges of living with IF. Monitoring and follow-up, regular assessment of growth in children, hydration status, and nutritional adequacy. 7. Emerging and adjunctive therapies. Probiotics or prebiotics, for microbiota modulation in select cases. Stem cell therapy, experimental approaches to regenerate intestinal tissue. Treatment should be multidisciplinary, involving gastroenterologists, surgeons, dietitians, and other healthcare providers to optimize outcomes.